if we shift gears a little bit, another really important issue that comes up that undergirds education is people's access to health care in Texas and the border communities. And this has stirred up so much controversy with the bill they call Obamacare having been passed, and many states now are sort of in a backlash mode to try to repeal some of those provisions in that bill. So Ms. Moreno looked into this area, and she has a few questions that she'd like to pursue on healthcare.
Great.
Senator, you refer to Texas as ground zero for healthcare. We just wanted to ask you, what is the current status of healthcare and health insurance coverage in Texas and in El Paso? And how could the universal healthcare law help alleviate some of the issues?
Well, we started talking about this issue as far back as Unite El Paso in the early 90s. And when you get into the economics of a job in El Paso, in the old days, and I'm going to date myself a little bit here, but let's say right after World War II. I'm not that old, but I've heard about World War II. The idea was that if you went to work, you'd have a job, you'd have a pension, and you'd have health care. It came with the job. And health care at the job was the norm for most American workers. Now, it's not. Fewer and fewer major American companies can afford to provide health care. In fact, the General Motors bankruptcy was really about shedding health care and pension liabilities. And so the question becomes, as we compete with other countries, particularly in manufacturing, and they have universal health care systems, all our major competitors really have it, save perhaps China in a profound universal sense, but certainly all the Western European countries. And we're carrying the cost of health care in a rising cost environment on a car. $1,200 of a car is American healthcare costs. So a country that's already paid for that, France, England, others, Germany, they don't have that cost embedded in their car. It's making us non-competitive in jobs, not just in healthcare. So if you look at what's happening in those healthcare costs, a young student out at Montana Vista, for those of you who've never been, it's at the end of the road on Montana. It's a beautiful community. But if you had a terrible earache there, you'd have to go to Thomason. And something that could have been handled with $4 worth of drops at a clinic in Montana Vista becomes a $4,000 hospital operation 45 minutes later. All of that could have been prevented. It's foolish not to have a well-designed universal healthcare system where much of the dollars are focused in the preventative care arena. El Paso is the least insured big city in America. If you define big city 500,000 or more, we have more uninsured than any large American city. And so what's happening? The cost of the uninsured is being transferred to the public hospital system at its highest and worst cost use. That $4 earache has become a $4,000 operation because we didn't have a health insurance system and a clinic where that young student could get care in Montana Vista. So at the end of the day, your economics of the region are proving to be untenable. You can't do it. If there is a community in this great country that's going to benefit from universal health care, welcome to El Paso. It's us. We have something like 235,000 people that have no health insurance at all. So the idea of creating a system where people have health insurance, from young students to the elderly, just makes sense. It makes us more competitive as a community, as a state, and as a nation. And even going back into the early 90s, we were talking about the need to make this happen and that this community should be leading that effort. I think the Obama healthcare initiative will prove to be his most important piece of legislation. When people look back on Barack Obama as a leader of this great country in trying to solve the core issues of the day, energy independence, healthcare, what we do with the profile of our military and wars that he was in before he even got into office, those will be his legacies on how he's viewed. But solving this issue and having a solution that works will be his legacy. We've been trying since Teddy Roosevelt to get a universal healthcare system. he did it.